Joining me in our Washington studio is Dr. Joel Selanikio. He's an attending physician at Georgetown University Hospital and a former outbreak investigator with the Centers for Disease Control and Prevention. Doctor, welcome to our program.
Thanks for having me.
I remember the last time you were here, we were actually talking the flu outbreak in the United States. So put things in perspective for us. Which one is more dangerous at this point based on what we know, the flu or coronavirus?
The flu, for sure. But the problem, I think, with coronavirus is there are so many unknowns. So the flu is an enormous health problem in the United States, and every year you have, tens of millions of people getting flu, and you have tens of thousands of people dying. So this year, I think the toll is somewhere between 10 and 15,000 Americans have died from flu. As you know, with coronavirus, even in a country as dense and heavily populated as China, they've had less than 400, I believe, something around 400 deaths altogether in China. So especially for an American, where we've only had a few cases here that were all linked to China.
361 cases, by the way,
right.
17,000 confirmed cases of the virus. Yeah.
Right, and so in the United States, really, the danger to Americans is the flu. There's no question about it. In China, I think it's a different story, at least in the immediate sense, because there's so much we don't know. We don't know what percentage of people who get the virus will die. We don't know the things that affect that, although we think it's similar to the flu, that people who are older are probably more vulnerable. We don't know how quickly it spreads, the so-called R0 that people keep discussing on the news. How many people does one infected person spread that virus to? We just don't have the answers to those questions.
So let's talk about what we do know when it comes to how coronavirus is transmitted. What do we know?
So, well, for sure, we know at this point that there's droplet spread. That is to say that when you cough, et cetera, there are little droplets of infectious fluid that contain the virus, and those can go, let's say, 5 feet away from you.
Which is similar to the flu.
Exactly like the flu. They don't know yet whether there's airborne infection, which would be similar but extending a further distance away, things that stay in the air longer and can infect more people. And I just heard, actually from your program, while I was waiting, that they've detected the virus now in the feces of some of the patients, which would potentially mean that there could be so-called fecal-oral transmission. Although, as we talked about, that's the kind of thing that really you're talking about people who live in a very bad sanitary situation where the sanitary water, where wastewater is not separated properly from drinking water. And I think, of course, most Americans, and I think at this point most Chinese, do not live in a situation like that. So primarily now we think it's droplet infection. It may turn out that it is in fact also airborne.
So what is the difference here between an outbreak, an epidemic, and at what point does it become a pandemic?
Sure. Well, to me, outbreak and epidemic are very similar terms, and people argue about this all the time, but certainly more cases of a particular disease than you expect to find. When an epidemic becomes a pandemic, that's when it crosses national borders.
Well, this has.
Absolutely, or crosses regional borders and begins to spread in those countries. So, for example, if there was a disease X that happened in, say, Belgium, and someone went from Belgium to France with disease X, that doesn't mean there's a pandemic in France.
I see.
Right? It doesn't mean that it's a pandemic because you just took some person with the disease and you transported someone else to somewhere else. What a pandemic is when the disease begins to reproduce and spread in other locations. And so far, the cases of person-to-person transmission have been very, very limited in places outside of China. Right, spouses, for example, not the kind of thing where someone walked into a shopping mall and infected, 200 people.
And I got to ask you about these travel restrictions from people coming from China into the United States. The U.S. is not the only country. A number of other countries have basically instituted these kinds of restrictions. Is this a good idea? Does it really help?
The answer to that, like with so many of these questions, is we don't really know. Historically, travel bans have not done very well in terms of restricting spread of disease, which is kind of counterintuitive, but we don't have a lot of evidence that they are effective. And I would say that probably most of the public health community doesn't believe that they would be effective. There's also, of course, the downsides of travel bans economically, et cetera, and in all sorts of other ways. But again, the answer really is we don't know. We'll find out.
Yeah, so many unknowns at this point.
Absolutely.
Dr. Joel Selanikio, thank you so much. And the World Health Organization says closing borders could actually have the opposite impact and help spread the virus if travelers simply defy the restrictions and manage to get in anyway. Jonathan?